back to Watch for Deer. We have a very special guest today here at the podcast studio. We have with us Miss Alisa Smith, who is a nurse practitioner. Welcome, Lisa.
Hello.
She owns Enlightened Weight Loss and Wellness Spa in Barboursville,
West Virginia.
And we wanted to bring her on and talk about
The scariest thing that we're ever going to talk about ever. This is going to be the thing.
We're going to put
the
a
worst.
trigger warning with this. We're going to talk today about perimenopause and menopause.
Ew. It's the worst. It's the worst.
So we're glad that you came on the podcast, and we're excited to learn a little bit. Sam and I both have been...
I've talked about it a little bit on the podcast.
Yeah,
I talked about it a little bit. I'll talk more about it, like, with you. We're just going to have a conversation. Because I just about lost it around December. Just about lost my mind around December.
Yeah.
And so that's what we're going to talk about. So you all know, and you won't, I don't want you thinking that you're flipping out. However, there are going to be some warnings because some of my symptoms, I thought I was having a heart attack. So I don't want you to be like, oh, I'm not having a heart attack. It's perimenopause. And then your ass drops dead and it's going to be my fault. So no, if you have my symptoms, go on to the hospital.
Go consult a medical professional.
Yes.
This is just for educational purposes only.
But we'll get into that also. I've had the sickness here lately, and if you hear me like and cracking in my voice and stuff, it's the allergies.
It's the smoking.
Shut it. Also,
the smoking.
Here's another thing that you need to know about me and Doc here. We're family, and so we're hard on each other.
They are. As she should be.
But before we even get started, we have a new wine to test out. And we've got it here. And this is Pacific Fruit Vineyards Sweet Pineapple Wine. Grape vineyard with natural flavor. Alcohol, 9% by volume. Our cups are filled. Girls,
let's do it.
Let's try.
Here's to perimenopause and menopause, ladies.
Here you go. Take a drink. Big drink. What happened?
I got a little excited.
Why?
I spilled a little. I need a little bib.
All right. Do you like it?
It's very good.
Do you like it?
I do.
It's pineapple-y.
It's super pineapple-y. I bought it at the Aldi for $3.99. I swear I got it yesterday. I keep it stocked for when like people come over and they're like, "Do you have any wine?" Yeah, I've got
Aldi has the best wine.
I have a $4 wine. It's $4.
I like Aldi wine.
It's so good, isn't it?
I'm impressed.
You should be impressed.
Aldi. All right, let's go.
The best.
So,
well, let's start off with the first thing. Lisa Dawn. Okay, so I call her Lisa Dawn. Her name is Lisa Smith, nurse practitioner. Lisa Dawn comes in and she goes, do you remember that cup that Mama had that was that titty? And I was like, oh my God, yes, I remember the cup that Mama had. Mm-hmm. And she says that because I have a big busted ashtray over here. It's actually Scott's. We're sitting in our bar right now, and that made her remember that. And then I remembered Mama had, it was one boob.
One single boob.
It was a single boob.
The nipple had a hole in it.
It did. It was a creamer.
I don't know.
It was a creamer.
Yes.
It was a,
You pour some cream in your coffee.
Yeah, you put it in there and you poured out of that nipple for the coffee. It was the late 80s, early 90s. It was a nipple creamer. And I asked her, I was like, where is that cup at?
It exists somewhere, I bet.
We got to find that cup.
That's awesome.
Because nobody's going to appreciate that cup like you and I would.
Right.
Yeah.
Than the nipple creamer.
Family heirlooms.
West Virginia fairly heirlooms.
Fairly heirlooms.
Family heirlooms are the best.
Family heirlooms.
All right, so let's get right into it because this is a scary story. And I know that there's, like, especially like when I talk with people, they're always like, oh, what symptoms did you have and stuff? Because some of them don't think that these symptoms, well, like you said a minute ago, and you could elaborate on this, well, it's not perimenopause, it's not menopause, I'm not even 50.
Right. It can start earlier than anybody even
So let's
realizes.
start with your story, since you're kind of in that perimenopause stage.
Yeah.
And then she can kind of just weigh in on what you're going through and just kind of explain all of that to the listeners. And then we'll jump to me, who is in full-blown menopause.
Yeah.
And I am the youngest.
Yeah.
So go figure.
Are you younger than Lisa?
No.
No, I'm not younger than Lisa.
You're younger than
I'm
me.
younger than you.
Yeah, but I was going to say my ovaries feel younger than yours. I don't know why I was going to say that, but I just feel like internally I'm younger than you.
Internally, I would agree with you because I have the innards of an 80-year-old lady.
The innards.
The innards. I got the innards.
Your innards are yarn.
Oh my
Yarny.
God.
Your innards are
I
yarny.
got the Kearney innards. Okay, so go ahead and explain to our listeners.
What happened?
Yeah, what happened with you?
So December, that first snowstorm we had, was it December? I don't know. I just felt wonky. You know, I just didn't feel good. Like I felt wonky. And then we had that first big snowstorm. Maybe it was around the 1st of January or something. This wine's going to make me burp. Hold on. Excuse me. So we had that first big snowstorm, and I had my first big, panic attack. And I thought, and if you've not had a panic attack, and I actually think mine turned into GAD, general anxiety disorder, all caused by hormones, but at the time we didn't know. I was pacing the floor for no reason whatsoever. I mean, it's not like it's not snowed up here before, but in my mind, I couldn't get out if I needed help. I could not get out. So, because the snow was so bad and Scott was at work. So, I was pacing the floor. I started vomiting.
Oh, my gosh.
And then I had pain shooting down my arm. My heart rate was ridiculous. I was having trouble breathing, but it wasn't like my throat was closed off. It was just because I was panicking. My jaw hurt. And at that point, I convinced myself that I was having a heart attack. So, which made it worse, and it didn't get any better. And I ended up at the hospital. Scott come home and he took me to the hospital. They checked everything. They did an EKG and everything. And I did exactly what you should do when you have all those symptoms, is go to the hospital. They did all that. They were like, you didn't have a heart attack. You had, the doctor's name was Ben, I think it was Ben Jude. I think I remember his name. And he was like, do you have anxiety? And I was like, I do not have anxiety. He was like, well, I'm pretty sure you had a panic attack. I was like, there's no reason for me to panic. I wasn't doing anything
to make you panic.
So they gave me some kind of medicine. I don't remember what it was. I came home and I did the same thing. It was it wasn't that bad like the rest of the week, but it never did get better. It was like I was in a constant state of anxiety.
Fight or flight.
Yeah, and I was miserable. And I would get really bad, and then I'd take a shower and all this stuff, and I would tell Scott, I'm telling you, I'm having a heart attack. They're wrong. I went back to the hospital. Again, they did the blood work and checked, what is it that they check for your blood? To see if you're having
a troponin.
Yeah. They checked to see if I had all those markers, did an EKG and all this stuff. My blood pressure was high, but they were like, no, it's just anxiety. Then I went to the doctor, saw Dr. Davis. And then I went later on and saw, and then I saw Lisa. And so she gave me medicine. She can tell you everything that I'm on because I gave her full rights to tell,
To violate the HIPAA.
To violate the HIPAA. She has full rights to violate HIPAA if this is going to help somebody.
We are 100% giving consent to violate the HIPAA if this helps any of our girls out there.
But the thing about it is, usually when you go to the doctor and stuff, they always ask you, well, when is your last period? Is your periods wonky? Well, guess what? Mine's not, because I don't have one.
Yeah.
I had my tubes tied in ablation years ago. So I don't have periods
a cycle
to know what's going on with me. I just know that at this moment I'm going batshit crazy.
Yeah.
And you know how some people, they're like, oh, I was vicious, I wanted to punch somebody and all this stuff. The only thing that I ever did, if I laid in bed and Scott would start snoring really loud, it usually never did bother me. I would just go to the couch, but I'd be like, if I put a pillow over his face, would it be terrible? And I thought, yeah, you need meds.
Probably
you need some medicine. Yeah. Maybe just a little. Maybe. Just a hint of a medicine. So, anyways, we did the blood work, all that stuff in January. Went on the Lexapro, which Lisa Dawn can tell you more about that. But, I was losing my hair. I have noticed that the hair on my legs is not, it's just spatchy now. which is not, I mean, some of the things are not terrible, right? Some of the things are
well,
not
as long as it's on
terrible.
your legs and not your head that you're losing it, because
But
you
I
can't
was-
have hair loss on your head too.
I'm kind of like,
Let me tell you something. The crown of my head, I feel like it's not as thick. One of my best friends at work, she's doing the same thing. She's in her late 30s, and she's like, my hair is not that, thick anymore and all this. She went and got blood work. But anyways, I feel better now. It's been months. I'm on Lexapro and blood pressure medicines and all this stuff. And I actually think now that you've got me on, what am I on? That patch?
Mm-hmm.
What's it called?
Estradiol?
Yeah.
Yeah.
I do that estradiol patch. I feel better, and I think that I actually don't think that I need the Lexapro. I think that
the hormones.
So this is the thing.
Yeah.
It's when women come in with these complaints, they're much more likely to get prescribed an antidepressant or an anti-anxiety medicine to treat you right then, because that's what's going on.
Yeah.
But the underlying cause that you aren't fixing is the hormone imbalance. So if you're not somebody that's had like major anxiety, major depression like your whole life, it's just, like you said, kind of came out of nowhere to be that extreme. Typically, there's some underlying cause that's going on that triggered it to be so bad.
So, I think everybody, I've always had depression, where you have days of I don't feel good, or I look in the mirror.
But it was different.
But this was different.
Yeah.
And you remember, too, years ago, you were in either nursing school, nurse practitioner school, when Papa passed away. I had to go on meds then because I was devastated. We were devastated, So I went on meds then. And I was on it for a long time. You had me on it or I don't even think it was you then. I think it was somebody else. But I went off of them, after about 10 years. I've not been on anything.
Right.
I've been fine. I have moments of, but it wasn't really even depression. I said I've always had it. You have days of
Everybody has bad days. Everybody has bad days. But these are more than just a bad day.
Because when your estrogen tanks, that is it's related to your serotonin and your dopamine. So that's why anxiety and depression can be triggered so much with the perimenopause stuff, because your levels will skyrocket and tank and skyrocket and tank. And those surges are why you'll have times of oh my God, what is going on? Why do I feel this anxious or this bad?
At what age though? What is the youngest age that you have seen this in?
I mean, it's not uncommon for it to sometimes happen in the 30s. Now, obviously, if someone has had a hysterectomy with their ovaries also removed, that will happen instantly. Your ovaries, are your hormone producers. So if you get rid of those at any age, it's going to throw you into surgical menopause. But naturally, I would say mid-30s, it can happen to where you see it. And I feel like we're seeing the hormone imbalances earlier and earlier.
And I think
Then,
it's because
in men
of all
and
the
women.
shit in our food.
It probably is. It's the microplastics too,
It's
probably.
all the stuff in our food.
It's just everything.
It's just
We're not
everything
healthy.
We're consuming,
Yeah, all of our stuff is not healthy.
for sure.
This wine is pure pineapple, so you're welcome for that. And it's
Thank
probably
you.
got a little yeast in it, so gut
Yeasty,
health.
yeasty.
Gut health.
Yeah.
But, so, and what is so let me ask you this. So, I went crazy. Let's call it crazy. I didn't know at the
that.
time.
A little
it
bit.
was
Little bit
perimo-
batshit.
Yeah,
I
little
love
bit
that
batshit.
word.
Batshit
Batshit
crazy.
Yeah.
crazy. That's what it is.
It was.
Essentially,
It was.
that's what it is.
Because I really, it was.
I had to talk her down a lot.
She had talked, I call her, she'd have talked me down a lot.
Yeah.
Because the thing about it is, the physical pain of it, your heart beating that fast and the pain and stuff, it's an actual pain. It's not.
Anxiety can absolutely cause weird, crazy physical symptoms.
I would get,
symptoms.
so some of my symptoms, my feet would get really cold. Shut that door. Hold on, Ginger's trying to come in. And I don't want Ginger, my dog, to hear about my feet. So my feet would get really cold, and then my hands would get really cold, and I'd kind of start shaking. And then I'd be like, oh no, what's going to happen? So, and then my heart would start beating, and then it would start hurting. I was hyper aware of everything.
Every
every
symptom,
pain
every
I have,
feeling.
every beat of my heart, everything. I was just so hyper aware of it, and anything, at that point, a few weeks after I had all those chest pains and stuff, and they're trying to tell me it's anxiety, I'm on Lexapro, it's not helping yet.
Right.
It is, but it's not.
because you're just still fighting a losing
Yeah.
battle.
Yeah.
And I was taking hydroxyzine to help me calm down, which that was a wonderful pill.
Yeah.
It really is. But I would just, the thought of having a panic attack was causing me to stay in a constant anxiety attack. And I would have a little headache, oh no, I've got cancer.
Oh my gosh.
My nose is starting to run. Oh no, I've got COVID. You know, like
Anxiety is irrational.
it is. Like
Yeah.
I have a pain in my leg. I have a blood clot.
Yeah.
I've never been like this.
I'm pretty sure I talked you down from multiple like ER trips.
Yes.
Because you're like, is it this? Are you sure it's not this?
Yeah, and I tell you how I used to be, and we did an episode on this. Remember last April, a year ago, when I cut my head wide open and about bled out here at the house? I literally threw a rag on my head, and I was scared. But I ran to the road, come back, stitches all in my head, all the way behind my ear and everything. And I'm like, I'm fine. If I'd have done that in December or January, I
not
would
have
have had a
been fine.
heart attack.
Yeah.
You wouldn't have even been fine.
That's what I'm saying. Like, so for this to happen was abnormal.
And I don't think perimenopause wasn't the biggest thing on the radar then, because people think hot flashes, period changes, that's when like the hormone stuff gets to be more on your radar. But when you're just like, what is wrong with my brain?
Yeah.
I don't think a lot of people realize it's not just a hormone thing. Like we think menopause and perimenopause, I always thought sexual reproduction system. It's not that. It's from head to toe. It's everything in between.
Literally, it can cause brain fog. Of course, the stuff people know, like the hot flashes and period changes, but decreased bone density, so you can be like at a bigger risk for fractures. Changes with your metabolism, so if you're trying to lose weight and you're like, man, I'm doing everything right, what's going on? If your hormones are off, it makes it even harder because you're having the metabolic changes too.
Yeah, isn't that crazy?
Well, it is. I didn't have, though, when that first happened, I did not have the hot flashes. That was not a
And sometimes
symptom.
that comes later, and not
And it
not
did.
everybody has the same symptoms.
Yeah.
Like it's not created equal for everybody. Like, I mean,
because we're human.
I had
there's
hot
literally like
flashes.
30 to 40 symptoms that could comprise menopause, and not everybody's going to have every single one of those.
Well, my thing was back in 2020, I had my neck operated on. I had an ACDF.
You were going to say I had my neck done, don't it?
What's your
Do you
thyroid?
like
What
this?
was this?
It's so tight.
I was so sick of looking at you tuck your neck.
Oh
and
my
now it's
God.
not.
I had my 3 chins removed. But 2020, I had my ACDF surgery, and I had been put on Celexa or
What is
Cymbalta.
ACDF?
So it's basically they took out one of my cervical spine vertebrae and filled it with a bone graft, put a plate and 4 screws in my neck because there was a rupture. So it was causing my left arm to go completely numb. So I had been put on Celexa or Cymbalta, one of those that treat nerve pain. Cymbalta. And I had gained like 40 pounds in 2 months, like just blew up. Well, after I had that, I thought, okay, I feel better, but what is this? Like, I thought the medicine that I was on was causing my hot flashes because I would sit and get ready in the morning topless with a towel wrapped around my body and constantly patting my face because I was sweating so bad. I couldn't even get ready for work. But I attributed that to that medication because when I looked it up, it said that it could cause various symptoms. And then last year, I messaged Lisa. I was like, I think I'm going crazy. I think something's wrong with me. She was like, come in, we'll do some blood work. And that's what I did. And she found out, she's like, you don't have any hormones. Which makes sense.
Yeah.
You know what she said?
You had like
Lisa?
negative
I had
estrogen.
negative. Like,
Not
I
really,
had
but
nothing.
yeah, you should, basically.
Do you know what she did when she came in? I'll never forget it. She walks in through the sliding door, opens it up, and goes, "Bitch, I'm in menopause."
I was like, I knew I wasn't crazy. But, you know.
I validated her. You're
did.
welcome.
She did. She validated me. I just knew I was off. There was something, I couldn't put my finger on it. I couldn't figure it out, but I knew something was off. So I messaged Lisa. I was like, I need help. Like, I need something. Something's going on. And she, she did. She took my blood, and then she messaged me, and she's like, you ain't got no hormones.
Literally.
So I was like, oh, okay. So that makes sense.
So, Lisa, let's talk about ours. Do you remember my blood work?
Yeah, the first time we checked it,
Which in January.
Yes, you had the crazy high estrogen levels, which is indicating, like, where you're having hormone surges and then you drop to nothing, and that's when a lot of the symptoms can happen.
So when I went in and did the blood work the first time, I actually felt okay. Like
because you had a big surge of it.
But I think the anxiety at the time, it still was like bothering me. This is January, you know, the medicine hadn't taken effect, and I wasn't on any patches or anything then.
Right.
But when I saw that, and let me tell you, like, this is the way my mind was working then, and I'm way better now. One of those said, and I don't remember which one it was, you know, you get your little, you tell me my information stuff. And it said that I had so much estrogen in my body when they took the blood that I was in the first trimester of pregnancy.
Yeah.
Is what it said. And
because because your body is trying so hard, like you go to nothing, and then your body tries really, really hard to make estrogen, and then it overcompensates, and you have this big surge.
Because I swear, I even think I told Clinton at one point, I was like, I'm going to go buy a pregnancy test because my boobs hurt.
Yeah.
And I could smell things. Like, I was like...
When your estrogen's higher, you can have those...
I was like, I don't smell things because my nose, like, I just can't. Like, I can't smell. And I said, I'm going to go get a pregnancy test, which would be absolutely impossible for me to be pregnant.
An ablation and tubes tied.
I had my tubes tied a month after I had Dylan in 2011. I had a uterine ablation in 2017. I've not had a period since 2017. But it still had me thinking. I was like, oh my God, could I really be one of those freak accidents that's pregnant at 40? 41? What? Scary as hell.
My mama got pregnant with my mom when she was like 44, 45. She's not a freak, Alisa.
No.
Like, anyway, but like, so when I saw that with my anxiety, like when it said that I was in the first trimester of pregnancy, I had so much estrogen, I thought, I have ovarian cancer.
Jesus.
I did.
Yeah.
Like I did. That's where my brain was going. Like that's what this was doing to me. And I knew something was wrong, but now it's saying I've got all the estrogen. I've got all the things. And I'm like, something's wrong with me. Yeah. And this blood work's not showing it now. So, you know, I don't know what to do. And I was just going deeper and deeper into like an anxiety.
Which we suspected it because, again, you aren't in the first trimester of pregnancy. So with the symptoms that you're having and those crazy levels.
No, ma'am, that weight is a biscuit.
We nipped that in the bud. We nipped that, yeah.
But then we did do it again.
And as expected, the levels were non-existent because you were having the surges and the drops. Okay. Yeah.
And then when I did do it again, I didn't feel as
Your estrogen
great.
was like 4.
Yeah.
It was something crazy. Yeah.
Another thing that I've got going on, which we're trying to manage, which we'll probably have to fix this again because it's at this moment not working. I'll go ahead and tell you now. Let's pretend we're in the office.
Okay.
I can't get my blood pressure under 150. And I'm using sea salt now. I don't eat ham. I don't eat bacon. I'm doing all the things. I never had blood pressure problems at all until this.
And
at all.
Blood pressure problems?
Well, I think it's more the state that your body is in.
It's just in a fight or flight mode.
Yes, after you have been on this more and you're more regular, because you've only been on it for like a month, maybe 2?
The new medicine?
The hormones.
Oh, the hormones. I will put my 3rd patch on.
Okay, so you're super new in the patches. You aren't regulated yet. It's going to take a little bit longer. So hopefully, ideally, after you've been on it for a little bit more, the rest of your body should stop freaking out too.
So if we have women listening right now, Lisa, like what, and they're doing this, or even they think, oh, I'm going crazy. This is not a real thing, you know, or if they're flying off the handle, like I never did that because I'm a super sweet person. But if you automatically go to mean, but they're normally not a mean person, or if they're crying over silly things and they normally don't cry over things, or, you know, and they're like, something's wrong with me. Like, could it be hormonal if they're in that age? Yes.
And the thing is, you know, you're the person that knows your body the best. So if you feel like something is not right, odds are it's probably not.
Trust your gut.
Yes. So in that instance, I mean, you need to, you know, if you have a regular provider, talk to them. If not, find someone that can listen and be receptive to, like, okay, well, we got these levels and it's not really showing anything, or it's not really that. Sometimes things need to be rechecked because, especially with perimenopause, the labs can be not always, like, the symptoms can sometimes be more like, you know, indicating what's going on versus the labs, just on one lab set. And a lot of providers aren't comfortable with, like, menopause or perimenopause. So sometimes finding a different one or a GYN that's like, just more familiar with it, because I feel like women are told more often than they should be that, well, everything looks normal, so it's not that.
And I think too, and I know I just got put on a thyroid pill, and every time I've ever had my thyroid checked, everyone has said, oh, your thyroid's great. But this thyroid that was low was like TPO or something.
That's an antibody, yeah.
Okay, it was like TPO. So I just think that you do blood work at your facility, correct?
Yes.
And I mean, even if you think and your provider isn't like, well,
some are more proactive than others.
Some are,
yeah.
absolutely. But it doesn't hurt to get your blood checked. You know what I'm saying? Like, it doesn't hurt to do a routine blood screening test.
Yeah, definitely.
So, what was that? Hold on, people. I was going to say something. Oh, another thing.
You got that brain fog?
Yes. Oh, it's so
Yeah.
bad.
Mm-hmm.
Do you know I was teaching the other day, like a month and a half ago, and I was teaching math, and I'm a pretty good math teacher. I'm just going to say that. So I was teaching math. I really am. Beep, beep, beep,
Yeah.
boop, boop, boop. And I could not think of how to answer this question for the kids. Like, I'm standing in front of my kids. They're all looking at me, and I'm trying to find the words. I know how to do it, but being able to do something and teach it to someone is different. I've taught this
I literally
many
have
times.
people who are like, am I getting dementia? No, you probably just don't have any estrogen.
I had to
I mean, not saying that early onset dementia doesn't happen, but more likely than that is probably
It's probably
a
something
menopausal, perimenopausal symptom, because,
happens.
but again, is brain fog like something people think of that
No.
the hormones are affecting? Everybody thinks the hot flashes, the periods, but it's really so much more than that. Like you said, it's a head to toe, everything can be affected.
Well, I tell my kids all the time, they're like, hey, Mom, where's this? And I'm like, oh, it's over there on the thing by the fridge, the thing. And they're like, Mom, use your words. And I can't. Like, I can't use my words because I know what the word is. I can't get it out.
He'll say, I can't use my words because I'm from Dunlop.
I can't
Sorry.
use my words.
I'm just playing. I'm from Genoa, so I can say that.
She's right down the road.
Yeah. But I had to go over and get my teaching partner, Jill, and I told her, I was like, come over here and teach this to the kids and let me watch you because I've completely forgotten how to teach this. And when it all started, I did not have hot flashes. But
So have you had hot flashes?
oh
So
my
they've came.
God.
And sometimes stuff will come in waves.
Oh, Lord, did I get them. I mean, like, sleeping completely. Too much for the podcast. Just say that I was just laying in bed thinking.
In her birthday suit.
I was just laying in bed with an air conditioner on, set to 64 degrees in my room. I turned it down to 61 degrees, sit there, and I would sweat. But here's the thing about, like, the hot flashes I was having. Also, they've stopped. Just so you
Good.
know. So high five.
Woo! Estrogen, yay.
They have
So are you
stopped.
taking the progesterone?
Yes. Every
Okay.
night before I go to bed.
So
And
we haven't
it's an amazing
We
sleep aid.
haven't talked about that, but progesterone is literally a calming hormone. So it helps with anxiety. Like you said, it helps with sleep. You take it at bedtime usually.
love it.
And anytime we're talking about the hormone stuff, it's better to have the bioidentical hormones versus the synthetic.
So what do you mean by that? Because I don't know. Because
So like back in the
I know the
day,
algebra,
whenever everybody was
that's all I
like,
know.
oh, hormones are so bad, a lot of that was because of some of the synthetic hormones.
synthetic.
And they're still around. Like they are still prescribed and that type of thing. But it's better to be choosy about how you're replacing it. So there's less risks and better benefits and effects if you are choosing the bioidentical, which means it's literally the same as what's in your body. So
Okay.
as far as the risk, if you're taking it right and like dosed appropriately, you should just be at the normal level that your body needs anyway. So it's not like you're adding some, foreign substance into your body. It's literally the same hormone that your body should have anyway.
So what I think is funny that you mentioned that is, I don't know if you remember it or not, but I went to you after we did the second blood work, because you, and I was like, I messaged you or something, and I messaged her because she's family. You do not get her personal cell phone number. You have to call the office, people. But anyways, and I was like, hey, it says that my stuff's back. Can you look at it? She's like, oh yeah, you don't have this, this, and this. When I come in to see you though, the first thing I asked you was, because I was afraid to take the estrogen, and I was like, I'm afraid to take this. Will it give me breast cancer? Do you remember me saying that?
I do, and it's just like, it makes me like face palm so bad because so many people think that. And actually, the studies that were back in like the 90s, they have been, I guess, debunked almost, because the data really wasn't that good saying that like there was a correlation or causation thing. For most people, hormone replacement is actually super safe, and they've actually came out with a lot of new data that shows how much benefit estrogen has on your cardiovascular health. Oh, okay. So if you actually start hormone replacement therapy within 10 years of menopause, it decreases your risk of heart attack and stroke, and which increases your lifespan like significantly.
So that would make sense, because prior to losing all my weight, prior to getting on hormones, I was on atenolol. I took atenolol every day for the rapid heart rate that I had.
I take it.
And I also would take a half of a flecainide.
Yeah, you had like crazy SVT.
Yes. I even talked to you about that before.
What's SVT? I don't know what you're talking about. Say the words.
Supraventricular tachycardia.
Which is?
Her heart rate would just go way too fast, erratically, for no reason, inappropriately.
So I actually was driving home from work one day and I think I swung in and seen her. I was like, I don't know what's going on. My heart rate was like 170 or something stupid. And she was like, I was like, is it normal for me to do CrossFit and my heart rate jumped to 200? She was like, you're going to die if you keep working out.
That was my medical advice. Stop it. Just stop that right now. Stop it. Yeah.
But since being on my hormones, since losing the weight, I am no longer on that atenolol. I am no longer on flecainide, and I don't have those symptoms.
And not to say that would happen for everybody,
right,
but it definitely does show like the cardiovascular benefit of it, because it has anti-inflammatory effects on the vascular system too.
Yes.
So it can definitely help.
So that just kind of shocked me, because I'd been on it forever. And I think what happened, I couldn't get a refill or something, and I just, before I knew it, I was like,
you were just like, whatever.
I was like, oh, okay, well, just, whatever. Don't do that.
Just freeball this SVT. Go ahead.
Don't do that. Yeah, but...
Well, we had to take a moment and refill our wine glasses. So we're right again. So right here, girls. Ready?
Here.
Okay. So another thing that why am I saying so much? That's not normal, the wine. Anywho, I've been on the estrogen patches. It's actually been 2 weeks. So I've not come back to see you as my provider yet. But I'll go ahead and tell you this here. The first week I put them on, I cleaned my skin really good. Because it's going to stick for the whole week. Right?
Yeah.
And it doesn't come off in the shower or anything. Mine actually came off on Thursday, and I left it off, and I know what I did first. Like I got in the shower, and then I cooked something to eat and stuff, and before I went to bed, and I'm sure my skin got those oils. Those, I ain't going to do that. The oils on it. So
just let your Genoa out. It's fine.
I'm just going to let it out.
Go ahead.
I'm going to let my Genoa flag fly.
Right.
So that was Thursday. I didn't put it back on until Sunday. Well, I tried to, but it wouldn't stick. So it kind of itched me a little bit, like it was very noticeable that it was there. So that Sunday I put it on. I cleaned my skin really good. I dried it with a hairdryer, and then I put my patch on. Today's Sunday. Around Wednesday or Thursday, I was laying in bed, and I was like, this thing is itching me. It's really bothering me. And I went and looked, and I couldn't really see my skin, but I was like, I was scratching it, and I was scratching my butt cheek because that's where it was at. And I was like,
you'd wash it.
I was like, I have to take this off. I took it off, and where that patch was at, it was, I don't want to say blistered because it wasn't blistered, but it was all hived up, and the skin, like the bumps on it, were super red.
So you are probably maybe sensitive to the adhesive in it. And there are different options, though. There's other patches. Instead, some people like the once a week patch just because you can put it on and not have to think about it. But
I was about to ask you.
Are you on the once a week?
Twice a week.
Yes. So and also cost plays a role. Cost, dose, personal preference. There's lots of different options.
Well, I did take this patch off, and my other butt cheek was really clean. So I went ahead and...
So it was primed and ready.
Yeah. So my other butt cheek... I took it off my right butt cheek.
Yeah.
And just so happened when I showered that night, I went ahead and washed my left butt cheek also. So
for its weekly washing?
For its weekly washing.
Got you.
And I put it on my left butt cheek, and it stuck.
Yeah.
But my friend...
So is it irritated now or not yet?
Not now.
Okay.
That's weird.
But I will tell you what my friend Michelle said. I told her like when it first fell off, because I've only been on it 2 weeks and I can tell an amazing difference. But I told her Thursday morning, we were talking, I was getting ready, and I was like, Michelle, my estrogen patch fell off last night, and she gets the pellets. And I was like, it fell off last night. I don't know what to do because I really need this estrogen. I don't have any. She goes, eat it, Sammy. Eat the patch.
I would not advise that. That's not medical advice. Yeah.
So do not eat the estrogen
Don't
patch
do
if
it.
it falls off, or lick it. Don't lick it if it falls off.
There are other options that would be more acceptable than that.
Don't lick it.
Yes.
Don't snort it. Don't swallow it. Yeah. So just making sure that's fine. Like don't lick the patch. So Michelle was wrong.
Correct.
Well, she's not a provider. She's a teacher also.
Yeah,
so she probably doesn't.
Maybe
know.
don't take medical advice from teachers.
Yeah,
perhaps.
So one of the things that come back low on myself, and I want to just bring up is I had low testosterone. I didn't even know women could have testosterone. Can you kind of go over that? Because you had told me initially that was why I was so tired.
Right. Yeah, so I feel like that's something else that's not well known that women don't think about, oh, my testosterone level. But that is a common hormone that we do in replacement therapy, just because if you're at an optimal level with that also, it can make you feel so much better. It helps with memory, concentration. It can also decrease the brain fog. But energy and motivation.
Helps with libido.
It does absolutely help with libido, sexual wellness.
I was going to say, what's libido mean?
What does it mean?
It's
No.
I don't know. Ask Clinton.
No.
good for sexy time.
So when I went to the doctor, you told me that I had low T.
Yes.
And
But everything was low.
Yeah,
Yes.
everything was low.
Yeah.
All my stuff was low. Also, I'm on a Centrum now also.
Good.
I just want you to know that.
Good
But,
job.
and Scott, I swear to God, Lisa, when we went to the Walmarts up here.
The Walmarts.
And I was getting vitamins because I was like, I'm not eating all this food and stuff. And I'm going to start taking a daily vitamin too. And I've been drinking milk with my breakfast. Like, I'm trying to do better.
What's milk with your breakfast do
Because
anything?
I only drink water.
What does that even mean?
Like, it's got the vitamins in it.
Okay.
So I was just trying. So I'm standing
This
in front.
some other myth that I need to.
So I'm standing in front of all the vitamins, and I had asked the pharmacist in true Mantha fashion. Now this is normal.
Yeah.
I said, "Can I take a vitamin? You know what medicine I'm on? Can I take a vitamin and it not interfere with it?" And he kind of just looked at me, and he was like, "Yeah, you can take a vitamin."
Jesus.
And I was like, "Thank you," because you know how I am.
God bless that Walmart pharmacist for the questions they get asked, I bet.
Yeah. So he was like, yes. So I go over. I was like, well, I need a good rounded vitamin. I go over to the Centrum, and he goes, go over there and take the Centrum Women's one a day. I swear to God, Scott handed me the Centrum Silver. Nothing that there's wrong with anybody being over 50, but he does that shit, and he knows it makes me mad. It made me so mad.
That perimenopausal rage.
Woo.
Yeah.
Anywho, I don't even know where I was going with it. Yeah, I do. So I've not started the testosterone yet.
Right. It's kind of it's kind of better too to even start a little bit at a time, give you a couple weeks to adjust, and then introduce
But will
the next
it give
one.
me, because we talked about this not too long ago, like maybe last week's, and legit, like I know you're all going to laugh and you're all going to laugh too, but like this is a legit concern of mine. I really do have like a mustache. Like I have to wax it, and I really do have chin hairs. And I'm going to say chin hairs. It's a full goatee. It is a full goatee, and it has nothing to do with my hormones. Now I've always
It does
been
have
like
something
that.
to do with your hormones.
I've always been like that.
Okay, but it's probably fluctuated too. But if you're just getting a little boost, like you're at an optimal level, not an excessive level, you shouldn't have an increase in hair
I
growth,
don't want
acne.
a 5 o'clock shadow.
Okay, so if you took it and you started noticing a 5 o'clock shadow, then we would back down on it, because not everybody's on the same dose. So you kind of just have to try it, see how your body, see how your body responds to it as far as your symptoms and your blood levels, and then decide what works best for you.
I swear to God, if you give me testosterone and I have a 5 o'clock shadow, and
If
I will call
give
your
you
mother.
testosterone and you have a 5 o'clock shadow, you can stop it for 2 weeks.
I will
Things will
call
settle down, and
my
if you want to
aunt.
start it again, you can just do it a
I
little
will
lower.
call my aunt, and I will tell her.
You will tell her?
I will tell her that that's not right, that you gave me 5 o'clock shadow.
It would not be that extreme.
But
But that's the thing. If your levels are where they should be at a more optimal level and not excessive, then really you're not going to run into the hair growth, the acne. That's the most common complaint people have about. And going back to, like you mentioned, your friend was on pellets. Pellets are super popular. I don't personally like them because some people love them, some people hate them. And once they're in, they're in. You are stuck with that for months.
Yes.
And what pellets do is make your testosterone, like if you're getting the testosterone as well as the estrogen, which most people are, they make your testosterone level surge. So to begin with, you're like, oh my God, I feel fantastic. Because, you know, your testosterone level is probably 200 or 300. And
What should it be?
well, for women, I mean, if you're not on replacement therapy, you're going to see like less than 20,
I was
basically.
gonna say, mine was,
Yeah.
I think mine was like point something.
Yeah. So with replacement therapy, I mean, anywhere from like 40 to 60 is good. Some women feel good 60 to 100, as long as you're not having like ill effects from it as far as like the hair growth or the acne or anything like that. You can kind of be in the range acceptable within that, you know, that your body feels comfortable.
Is it a shot?
There's different methods. So I
do the
prefer
shot.
the shot. It's
I
a
do the
very
shot.
low dose, once a week. It's a
I'm
subcutaneous
not doing
injection.
it.
Don't
I'm
be a
not doing
baby.
it.
Don't be a
Puss.
baby.
I'm not doing. I cannot. I mean, I can.
You can do other stuff. There are topical treatments like creams and gels that you can do. You just have to do them every day. So that's why a lot of people like a shot versus the gel, just because you do it once.
I did the shot once a week.
Yeah, so
Okay.
it's and like I
my
said,
thigh.
it's a sub-Q shot, so it's not like a flu shot. It doesn't
It's
hurt. It's
like
not
a
going in the
diabetic
muscle.
size
Yes,
needle.
it's
so
tiny.
it's very small. It's a very small needle.
But other options are topical. So like you could rub a cream or gel like on your thigh or your stomach every day. But yeah, so there's definitely options, and not the same thing works for everybody. So sometimes it is a little bit of a trial and error, but trying something, if you feel bad, is definitely better than letting it
doing
go.
anything.
Because again, kind of going back to like the whole cardiovascular health, the long-term health, your body wasn't meant to not have these hormones. Just because it's like a fact of life that, oh, at this age, this is just what happens, doesn't necessarily mean that like that's
Don't
the best thing
settle.
for your body.
Right,
So, like-
don't settle.
Right,
And
so-
am I right to say that every treatment, so I feel like when people go to their general pracs,
Mm-hmm.
and I'm just saying general population here, people, I'm not, pointing fingers. When someone goes to a general practitioner, there's an average level for the population,
Mm-hmm.
correct? So even though you may be low or
Right.
correct, you may be on point
Right.
with what they're going by, you may be low for your body. Is
Right.
that correct? Like
It could
everybody,
be, yes. Like you
individual.
can, and just because like you're in the normal range doesn't mean that's optimal or where you're going to feel the best.
Right.
Like if you're having symptoms of like fatigue, brain fog, libido changes, weight gain, all that kind of stuff, you can, even if you're not fully menopausal, you can still benefit from some hormone replacement. Yes.
So
That makes sense.
in a month or so, once I get my estrogen in and my progesterone, and I already do feel better. Like I've not had any anxiety issues.
That's awesome.
I've not, like there's been a couple times. So I'll tell you that. Do you want me to tell you a funny story? Do we have time?
Absolutely. We have time for a funny story.
Okay. So this is what the medicine has done for me. Very long story short. Scott was super late coming home Friday, and I couldn't get a hold of him. And he never, did I tell you this story?
No, I just know you. You
He
panicked.
never doesn't tell me where he's at. Never. If he's going to be late, he tells me. So I'm cleaning the toilet, and he's like an hour late, all this stuff. And I'm like calling his phone, all this stuff, nothing. He's not answering. He's not texting back or anything. I look on 360. It says he's at work. And I'm like, well, okay, I'm going to go down and check just to make sure, because that's not like him. I go down to his work. I'm not going to say what he does. I go down to his work. His truck is there. But Scott has a work truck also. I don't know what his work truck looks like because he doesn't drive it home. Anywho, I am peeping through the window. He actually
Jesus
said,
Christ.
Hold on. He actually says that he's going to find the video
Peeping through the window of the workplace?
of his work. Yes.
Okay.
There's nobody there, and I'm like this.
Wow.
And I see a lamp on in the back. And I was like, okay, don't panic, Samantha. Don't panic. It's fine. He's out on a call. He has just forgotten to tell you that he's on a call.
And your brain's
And
thinking
there's
he's
work
sleeping
trucks
around?
here, but no.
Oh,
no.
okay.
No. But there's work trucks here. I don't know what his looks like because they all look the same. They're just different sizes. But anywho, I get back. Well, first of all, I get in his truck and I leave him a note. And it says, "Where are you?" It says, "Where are you?" His regular truck. I am worried to death. I didn't even sign my name. I wrote S. I get back in my car, and I thought, you know what? I want to call my friend Alan, who is, he is like, he's not above Scott because Scott's in a different county than he is. But if my friend Alan was in this county, he would be Scott's boss's boss, right? But Alan's just different counties. But he knows everybody because he's up there. So I called my friend Alan. And I said, Alan, what are you doing? He goes, oh, nothing, Sammy, just laying on the couch. I said, I need you to find Scott. And he goes, what do you mean? And I said, I need you to find Scott. And I told him what I just told you all. And he goes, well, is his work truck there? And I said, I don't know, Alan. I don't know if his work truck's here because I don't know what it looks like. He goes, oh, I think it's an F Ford 250. And I look and I said, well, there's a Jeep here. There's a F Ford 150 and there's a Ford 350.
An F Ford 150?
Whatever it's called.
Yeah.
Hello,
You know, I don't
Ford F?
Yeah.
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 It's fine.
So,
Hello,
but
Juan.
when I said there's a Ford F, what is it?
A Ford F-150.
Okay. There's a Ford F-150.
You said it backwards every time.
and a Ford 350.
Uh-huh.
But he was like, but before that he told me Scott's was a Ford. I'm just gonna say 250.
Okay.
And I was like, okay, so he's gone because there's no 250 here. But then I was telling him what was there. He was like, no, wait, that 350 Scott's work truck. My heart sank because remember when I was peeping through his work windows when everything was locked up, there was a lamp on in the back. And I said, and I'm going to leave out some of the words that I said, but I said this to Alan, I was like, if you don't find him, I mean, I went into full Liam Neeson Taken.
I have a very special set of skills.
That's what I said. And I did say the F word a couple times. I told my mama about it, so if she listens to this, she's not going to be surprised. I said, if you don't find him in the next 30 seconds, I'm going through this window. And I meant it because in my mind, Scott was doing paperwork and he's in the floor back there with a heart attack.
Are you serious?
Listen to me.
And this is after you're improving.
Oh, this is just normal me.
Okay.
And he goes,
Do we need to up that patch yet?
he goes, well, he said, well, I'll find him. I said, I'm telling you, if you do not find my husband, I'm going through this window in 30 seconds. He goes, stay in the car, Sammy.
Oh, my God.
I said, you can tell District that I will replace the window or I will sign my mugshot, but I promise you I'm going through this window. I mean, within like 15 seconds, he texted me. I can show you the text. It was like, Scott's with blah, blah, blah. They're on a work call. He forgot his phone at work. And I went, okay, good.
Batshit
I was like, I'm going home now. I'm going home now. And I come back and clean toilets. I literally, that's where I went. Like, I was completely fine until he said, no, that's Scott's work truck. And I went into full panic because there was a light on in there. And I told my mom later, I was like, you know that if I ever go to jail for breaking and entering, I didn't steal anything.
Jesus.
There was a reason for it.
There was a reason.
Had to preface it with that.
Okay, so Lisa, can you just kind of tell us if somebody's feeling off, what should they do?
So, yeah, even if you're younger, even if you think, oh, I'm too young for this, or it's not fully on the radar, the least you could do is get a blood workup. I mean, just to see where you're at. You can request this from your general practitioner, or if you don't have someone, these are services that I do at my wellness clinic. So we do full blood workup and have tons of different treatment options for hormone replacement and other general wellness stuff too. So,
and I think too, I'm losing my voice too because I've been sick, but also, and I'm not just saying this because I love you and we're family. I'm really not.
thanks.
I've been to several OBGYNs, and that's not what Lisa Dawn is. You know, she's a nurse practitioner. I get that.
Family practice.
Family practice.
Yeah.
But like,
She's a woman.
She's a woman.
Right.
And when I go in there to talk to her, like, she doesn't rush me out. I'm not rushed out. Yeah. She listens to me. And it's not like
I listen to your crazy.
you listen to my crazy,
Yep.
and you don't try to rush me out so you can get
The next
25
patient.
more patients
Right.
that day. Like, you actually take your time with me, and that's the reason I've not changed from you. Like,
you.
that's the reason I'm still with you is
Yeah.
because when I go in there and I look at you, like that one day when my blood pressure
That's
was
not
so
a family
high.
benefit either. I
No.
really do that. I have no desire to see 30 people a day and deal with your perimenopause.
Like, I did my blood pressure at
yeah.
Walmart that day, and I came over, and I
Right.
was scared because it was so high, and you were like, it's fine, you know, it's okay, calm down. And, but you take your time with me, and I do appreciate that. And you listen to my crazy, and you'll listen to their crazy, too.
Exactly.
Yes. So, Lisa, where can they find you and how can they get a hold of you before we wrap this up?
I'm at Enlightened Weight Loss and Wellness in Barboursville, West Virginia. and you can go to enlightenedweightandwellness.com, and you can schedule appointments on there for consultations. You can send general messages if you have some questions just to kind of get started.
Okay.
Can they follow you on Facebook?
Absolutely.
Do you have Instagram?
I do, yes.
Do you have an Instagram?
I do, yes.
Okay.
I need to be more active on
Can
there.
they message on Facebook?
Yes,
They
absolutely.
can?
Yeah.
So how many people do you have working there? It's just you and
My husband, Jade.
it's just you and Jade.
Yes,
And
he's a nurse.
And Jade's fantastic. When he gives shots,
He's the best shot giver ever. We
He's
give him props.
he
he's
is.
the only person that I ever let give me a flu shot. Until Jade, I always got the flu mist, and you always made fun of me. You're like, you're taking that away from a little kid, and I'm like, I can't help it. I get the
You're
flu
30 getting a flu mist. Come on.
I get the flu mist up my nose because I hate needles. And that's why I've not jumped right into the
So
testosterone.
I take it you're
so.
going to go with the tea cream. and
No,
not the
she's
gel.
going to show me how to give myself a shot.
Or you can
Give you a
come
shot.
let Jade give it to
and
you.
I will just go to Jade every week. But
We
yeah.
totally have
I
people
give
that
you
do
a
that
shot.
they come in the office once a week to get their shot just because they have that like aversion to
Yeah.
giving themselves shots.
So I can swing back there. Jade
Yes.
can do it. But yeah, and Jade gives me the flu shot, and I think he even booped me on the nose. Like, you know,
it was an added benefit.
it was an added benefit.
Yeah.
Jade is top notch.
Amazing. So we hope you enjoyed this off the wall episode. We know that there's a lot of women out there who probably are suffering in silence. Don't do that anymore. Reach out to your medical professional. Like always, follow us on Instagram, Facebook, TikTok at Watch for Dear Podcast. You can shoot us your questions, comments, concerns at watchfordearpodcast@gmail.com. And just like always, y'all be safe
And watch for deer.